Okay, my name is Ramandeep Kaur and I am from Yamuna, Nagar, Haryana. So presently I am working as a clinical instructor in College of Nursing. From that college only I passed my BSc Nursing. I'm training in the clinicals, I'm training the students regarding the procedures. I'm in medical surgical nursing department.
And this podcast your students will be listening to as well, in Mulana
Yeah.
College. ਤੁਸੀਂ ਤੇ India ਬੈਠੇ ਹੋ, right? Like you're sitting in India. How come you choose a Canadian institution for you?
So many students are passed now. Almost, I guess, 150 to 200 students have been passed at that time at the end of December and during the
That's
starting of
true.
January. So then, my two of my classmates, they are in Canada now. They also took coaching from you.
Yes.
And the students started giving exam after 3 months of coaching. That was very motivating. Otherwise I was not planning to give exam until 6 months.
I think what helped you is like because you are already a clinical instructor, right? So I think you already
Yes,
had
ma'am.
that insight in you because some people are there hesitant, right? But I think as a teacher ਹੁਣ ਤੁਹਾਨੂੰ ਆਪ ਵੀ ਪਤਾ ਹੈ ਕਿ ਤੁਸੀਂ ਸਾਰੇ ਸਟੂਡੈਂਟਸ ਨੂੰ ਗਾਈਡ ਕਰਦੇ ਹੋ. So I think you
Yes, ma'am.
already had that ਕਿ ਯਾਰ it's okay to take guidance.
And I really want to admire you that whatever you taught us in the modules, and you said that only software is enough and these modules are enough, and what important points you teaching us in the classes, they are really enough. They are really enough. But ma'am, yeah, I was very anxious and very nervous during exam day. Exam, I was very nervous. I was thinking that I should postpone my exam, but somehow my heart was saying that no, don't do this. And I said to myself that Raman, you have 5 hours. It's not like IELTS exam that you only have 40 minutes for writing,
Yes.
30 minutes for listening. You have 5 hours, and after 75, when it didn't shut down, I was little bit uh, nervous. And then I also thought that ma'am said it's okay. If after 75 the exam didn't shut, that means you still have the chance to pass the exam. After giving the exam, my papa was very bad, so I was crying. I thought I just failed. So I was crying after giving the exam.
So you are
after
out of those
coming back.
1% students where trick doesn't work.
Because after graduation, what I was thinking that only after graduation, within few days, I'll reach US or I'll reach some foreign country. But it is
That's
not
what
like
everybody
that.
thinks. Yes, that's true.
Yeah.
ਮਤਲਬ ਪਹਿਲੇ ਜ਼ਮਾਨੇ ਵਾਂਗੂ ਨਹੀਂ ਰਹਿ ਗਿਆ ਕਿ ਤੁਹਾਨੂੰ ਆਪਣੇ ਸੁਪਨੇ ਕੰਪਲੀਟ ਕਰਨ ਲਈ ਤੁਹਾਨੂੰ ਇਸੇ ਕੰਟਰੀ ਦੇ ਵਿੱਚ ਪਹਿਲਾਂ ਆਣਾ ਪਏਗਾ. You can actually
Yes,
fulfill 80% of dream over there itself. ਫਿਰ ਉਸ ਤੋਂ ਬਾਅਦ ਤੇ ਆ ਕੇ ਸਿਰਫ ਕੰਮ ਹੀ ਕਰਨਾ ਰਹਿ ਗਿਆ, right? And then that's beautiful. ਮਤਲਬ why do you have to go work or jobs ਜਦ ਤੁਸੀਂ ਆਂਦੇ ਸਾਰ you can work as a nurse?
Yes, ma'am. All are happy. I'm just thinking that I'm in Canada. पेपर मेरा clear हो गया. मैं तो ਹੁਣ RN ਦੀ job करने जानी है.
There you go. Hello, everybody. Welcome to our podcast. And today I'm here with a very special student, and her name is Raman. Raman is from India, Yamuna Nagar, Haryana. And she is today with us. She passed her NCLEX, so we would love to congratulate her in the very, very first attempt. And Raman is going to share her fantastic journey. Like she's still in India. So it's going to be pretty interesting. So let's just talk to Raman directly. Well, Raman, welcome to our podcast and congratulations on your success.
Thank you very much, ma'am.
So Raman,
It's all
give your
because of you.
oh, you're very kind. No, you guys worked hard. So do you want to give your introduction? ਤੁਸੀਂ ਆਪਣੀ introduction ਦੋਗੇ audience ਨੂੰ ਕਿ ਤੁਸੀਂ ਕਿੱਥੇ ਰਹਿੰਦੇ ਹੋ, ਤੁਸੀਂ ਕੀ ਕਰਦੇ ਹੋ?
Yes, of course, ma'am. Okay, my name is Ramandeep Kaur and I am from Yamuna Nagar, Haryana. So presently I am working as a clinical instructor in College of Nursing. From that college only I passed my BSc Nursing.
Wow.
And I have 4
ਤੁਸੀਂ
years
ਮਤਲਬ MM
experience.
college ਤੋਂ ਤੁਸੀਂ BSc nursing ਕੀਤੀ and when did you graduate?
I graduated in 2018.
2018. That's amazing. And then
Yeah.
after that you joined job there as clinical instructor.
Yeah, after the graduation, I did some staffing in Delhi hospital. and
Okay.
then again I joined my college,
Oh,
and
that
I
is
am doing
amazing. So now you are a clinical instructor. That's amazing. So ਤੁਸੀਂ ਕਿਹੜਾ subject ਪੜ੍ਹਾ ਰਹੇ ਹੋ? Like which subject you're teaching to the students?
actually I'm teaching. I'm not teaching. I'm training. Like in the clinicals, I'm training the students regarding the procedures. I'm in medical surgical nursing
Medical
department.
surgical, yeah. Because in clinical also,
Yeah.
like we have different categories, right? Like you take the students either to gynae or med surg or, you know. Okay. So
Yes.
you're taking the
Yes.
student to med surg nursing. Okay.
Yeah.
Raman, so ਥੋੜੀ ਜਿਹੀ ਆਪਣੀ ਜਰਨੀ ਬਾਰੇ NCLEX ਬਾਰੇ ਸ਼ੇਅਰ ਕਰੋ ਕਿ ਤੁਸੀਂ NCLEX ਐਗਜ਼ਾਮ ਕਦੋਂ ਦਿੱਤਾ ਤੇ ਕਿਉਂ ਦਿੱਤਾ? Like are you planning to come to western country ਜਾਂ ਕਿੱਦਾਂ ਹੈਗਾ? ਥੋੜਾ ਜਿਹਾ ਦੱਸੋ.
Yeah, actually, after the graduation, I was planning to come to US or Canada. So in the starting, I thought I should do IELTS, but then after doing IELTS, because of some issues and because of the long processes, and in between COVID also came, my IELTS also expired, and I could not, completed the whole process of getting the US and other country visa. So
Okay.
now again, I joined I joined college, my college as a clinical instructor because I thought why to waste the time? I should do something.
Yes.
So
Experience
after
always helps.
yeah,
Yes.
yeah. Meanwhile, I was doing job, and as well as I was then I was thinking that I should take the coaching of NCLEX also. So then two of my schoolmates, sorry, classmates, they are in Canada now. They also took coaching from you, Simran and Priyanka.
Okay.
So and yeah, and I also from your Instagram page, I also get to know about you that you also provide coaching regarding NCLEX. So I contacted you and I got registered. I started my coaching of NCLEX in the September batch, and then I just thought that now I should give it. After complete the main important thing that I gained from your batch is that it is the duration of the batch is only 3 months,
Yes.
and the students started giving exam after 3 months of coaching. That was very motivating. Otherwise I was not planning to give exam until 6 months. So
Yes.
when I saw in the group that students are giving exams even after 3 months, like Mandeep gave exam, Sukhpreet gave exam, and many other students were also like the group was very bombarded with the messages. So then I thought I should also give an attempt. I don't know, I just want to give an attempt because so many students are passed now. Almost I guess 150 to 200 students have been passed at that time during at the end of December and during the
That's
starting of
true.
January.
That's true. Your
So
batch
I
did
was
amazing. Fantastic results. Fantastic
yes,
results. Yes.
ma'am. So because and that was also motivating me, and I was also feeling nervous during that time that I think I was thinking that only I am left. So, ma'am,
Oh.
in the on 31st of January, I booked my exam for
And then you gave
31st
it.
at Chandigarh. I gave it, ma'am.
Wow, that is
Yes.
brilliant. That's a brilliant, brilliant, brilliant story. First of all, I want to say thanks to Simran and Priyanka for recommending because that was my next question ke ਤੁਸੀਂ ਤੇ India ਬੈਠੇ ਹੋ, right? Like you're sitting in India. How come you choose a Canadian institution for your training? ਕਿਉਂਕਿ ਕਈ ਵਾਰੀ ਆਪਾਂ ਇੰਡੀਆ ਬੈਠੇ ਹੁੰਦੇ ਆਪਾਂ ਨੂੰ ਪਤਾ ਨਹੀਂ ਹੁੰਦਾ ਹੈ ਨਾ ਕਿ ਲਾਈਕ ਕਿਹੜਾ ਇੰਸਟੀਚਿਊਟ ਸਹੀ ਹੈ ਕਿਹੜਾ ਗਲਤ ਹੈ ਸੋ ਮਤਲਬ ਤੁਸੀਂ ਦੱਸੋ ਕਿ ਤੁਹਾਡੇ ਫਰੈਂਡਸ ਨੇ ਰეკਮੈਂਡ ਕੀਤਾ ਐਂਡ ਦੈਨ ਯੂ ਕਾਈਂਡ ਆਫ ਟਰਸਟਡ ਐਂਡ ਗਾਈਡਡ देयर थिंग ਸੋ ਕੀ ਵਜ੍ਹਾ ਸੀਗੀ ਕਿ ਬਿਕਾਜ਼ देयर आर lots of people who provide coaching in India too ਹੈ ਨਾ ਕਿ ਖਾਸ ਕਰਕੇ ਆਪਣੇ ਪੰਜਾਬ ਹਰਿਆਣਾ ਚੰਡੀਗੜ੍ਹ ਦੇ ਵਿੱਚ ਬਹੁਤ ਸਾਰੇ ਇੰਸਟੀਚਿਊਟਸ ਨੇ what made you choose FPNPC? I know you have already told us one point, which was like 3 months of coaching. Was there any other
Yes, ma'am.
factor too, which was responsible?
Ma'am, I guess because you are staying in Canada and you are dealing with the Canadian nursing system and you know everything about the staffing and the clinicals
I
there, and
try.
most of the students.
I try. Okay.
Yes, ma'am.
Yeah.
And
Okay. So that made you choose that.
I yes, ma'am. And I really want to admire you that whatever you taught us in the modules, and you said that only software is enough, and these modules are enough, and what important points you're teaching us in the classes, they are really enough. They are really enough. Nothing extra comes in the exam. and it's very basic conceptual exam. You should, even if you don't know what new disease is there in the exam, whether they are asking the priority, important action, first action. So then after reading the options, you will get the answer.
You'll get the answer, right? That's absolutely
Yes, ma'am.
fantastic. That's amazing, Raman. Like,
Yes,
we are really, really happy for you. Passing this exam is one of the biggest accomplishments any student can accomplish basically in nursing
yes,
field
ma'am.
for sure. So,
Yes,
Raman,
ma'am.
from where you got the eligibility to write NCLEX? Because you are not even here, right? So where did you get the eligibility from?
Actually, I got the eligibility from New York board.
Yes. Okay, absolutely
Yes, ma'am.
fantastic. So, Raman, which country you're planning to move to, if I may ask that question to you?
Ma'am, I'm going to like in the end of this month, I'm marrying. Uh, it's my
Congratulations.
marriage. Yes, ma'am. So I'm going to Canada after marriage, ma'am,
That's
within few
amazing.
months.
That's amazing. So your would-be husband is already in Canada. That's brilliant,
Yeah.
right? That's
Yes,
well, welcome
ma'am.
to
Yes,
Canada.
ma'am.
We look forward to meet you in Canada, right? That's fantastic. Well, thanks
Yeah,
for
the
having and
procedure. Yeah,
yes, go ahead.
procedure is yet to start, but yeah, the planning is to go to Canada.
Oh, yeah, absolutely. No, we would love because Canada is running so short of nurses, right? And NCLEX
Mm.
exam not just only opens the door for Canada, but it opens the door for three countries, United States, Canada, and Australia, right? So that's why I
Yes,
asked you.
ma'am.
Well, that's
Yes,
amazing.
ma'am.
Tell me something about your journey in India, like, when you graduated and after that your teaching experience and this podcast, your students will be listening to as well, in Mulana
Yeah,
College. So what do you want to share with them?
my journey was quite interesting. I would not say that it is very smooth because after graduation, what I was thinking that only after graduation, within few days, I'll reach US or I'll reach some foreign country, but it is
That's
not
what
like
everybody
that.
thinks. Yes, that's true.
Yeah, it takes time because you need to get some experience for every country, almost every country. You need to do some tests, then you need to clear the exams, then only something will happen. So, ma'am, after graduation, I have done clinical experience. And, ma'am, during the clinical experience in India, I was not liking that job because of it was very struggling. And in India also, the things are very, difficult to do and manage in the clinical setting. So then I think that I should move. I should start, further studies in foreign setting. I always wanted to study foreign, especially in nursing, because everyone was telling me that when I started graduation from the first year, it was clear in my mind that I have to
You
go
already
to
had that dream that you want to
yeah.
do something, right?
Yes,
After
ma'am.
after
Yeah,
after a
I
year.
want.
And
So, ma'am,
so, yes, go ahead.
I gained experience, but after 1 year of experience, I was not able to, complete the process. And I came back at home, and then I joined again my college. And then I already told you that this is where I started because of my many college mates have had reached Canada during that point of time. So I also just suddenly it came in my mind that now I should start taking coaching. Only then I can do something. If I will
Yes.
not take any coaching, nothing will be possible. I was just, I was just watching YouTube free videos and just practicing any questions that were coming on the Google and on the YouTube free questions. But that was not it was not like a CAT exam. It was
Hmm.
not telling me what was my performance at that time, how I was doing. So
Yes.
that's why I think to check my performance and what was my level at that point of time, I needed a coaching centers, and then
I
uh,
think what helped
I
you is
started.
like because you are already a clinical instructor, right? So I think you already
Yes,
had
ma'am.
that insight in you because some people are there hesitant, right? But I think as a teacher ਹੁਣ ਤੁਹਾਨੂੰ ਆਪ ਵੀ ਪਤਾ ਹੈ ਕਿ ਤੁਸੀਂ ਸਾਰੇ students ਨੂੰ guide ਕਰਦੇ ਹੋ. So I think you
Yes, ma'am.
already had that ਕਿ यार it's okay to take guidance. है ना कि if I have
Yes,
to do
ma'am.
my exam in the first attempt ਤੇ ਮੈਂ guidance ਲੈ ਲਾਂ ਤੇ ਮੇਰਾ ਚੱਲ ਜਾਏਗਾ exam, right?
Yes, ma'am. Yeah, one benefit that I had is that previously already ਮੈਨੂੰ ਪਤਾ ਸੀਗਾ ਕਿ ਹਾਂ NCLEX ਤਾਂ ਦੇਣਾ ਹੀ ਪਊਗਾ, and ਹਾਲੇ ਵੀ after like in 2018 I graduated and after 4 years now I cleared the exam. ਇਹ ਵੀ ਮੈਨੂੰ ਲੇਟ ਹੀ ਲੱਗ ਰਿਹਾ ਬਟ ਸਟਿਲ ਇਹ ਸੀਗਾ
Still
ਪਹਿਲੇ
better.
ਕਰ ਦੇਣਾ ਚਾਹੀਦਾ ਸੀਗਾ ਜਾਂ ਪਹਿਲੇ ਕਰ ਦੇਣਾ ਚਾਹੀਦਾ ਸੀਗਾ ਹੋਰ ਚੀਜ਼ਾਂ ਬਾਅਦ ਚ ਕਰਦੀ ਤਾਂ ਕਿ ਹੁਣ ਤੱਕ ਮੈਂ ਉੱਥੇ ਪਹੁੰਚੀ ਹੁੰਦੀ
I
ਬਟ
know.
ਇਟਸ ਓਕੇ yeah it's
It's
okay
never too late in
I
life. ਉਹ
think
ਕਹਿੰਦੇ ਨਾ
now
all
yeah
is well when ends well, ਹੈ ਨਾ? ਉਦਾਂ ਦੀ ਗੱਲ ਆ।
yes yes ma'am
That's true.
I think ਅਗਰ ਮੈਂ ਜੇ ਮੈਂ ਕੋਚਿੰਗ ਨਾ ਲੈਂਦੀ ਤਾਂ ਮੈਂ ਹੁਣ ਤੱਕ ਤਾਂ ਮੈਂ ਇਹੀ ਸੋਚਦੀ ਰਹਿੰਦੀ ਕਿੰਨਾ like I have to study more deeply, more books, or like the surgeries part, how these surgeries are done, when what are the indications when the surgery should be done. But ऐसा कुछ नहीं हैगा जिद्दां तुसी किया only not superficial, only basic concept should be cleared. On the
That's
basis
true.
of your clearance of the concept, you can do any question.
And do you feel like Raman, because you're also teaching, ਤੁਹਾਨੂੰ ਲੱਗਦਾ ਹੈਗਾ ਕਿ ਜਦੋਂ ਉੱਥੋਂ ਪੜ੍ਹਦੇ ਆ ਜਾਂ ਪੜ੍ਹਾਉਂਦੇ ਆ ਤਾਂ ਤੁਸੀਂ ਕੋਈ ਗੈਪ ਮਹਿਸੂਸ ਕੀਤਾ? ਮਤਲਬ ਜਦੋਂ ਤੁਸੀਂ NCLEX ਦਾ ਪ੍ਰੋਗਰਾਮ ਕੀਤਾ, did you feel that there is actually a gap in the conceptual understanding from India versus here?
No, ma'am. No, ma'am. No, I felt no difference between the basic nursing of India and foreign studies. The only difference is that there in Canadian and like in US countries there is RPN, LPN,
Yes.
and
Hierarchy
these
is different.
differences are there.
Yes.
Hierarchy is different, but here it is not like that. It is only nurses, only same level of nurses. Otherwise, priority delegations, the concept of the priorities are same here. Obviously, ABC is the priority everywhere. But the thing is, here in India, it is not given much priority. And like the style of the NCLEX questions is different from the government exams of India. They
Hmm.
they ask they test the basic and the common sense that you always
That's
focused
true.
on in
That's
our
true. ਕਿਉਂਕਿ
classes.
ਤੁਸੀਂ ਸਹੀ ਕਹਿ ਰਹੇ ਹੋ ਕਿਉਂਕਿ ਉੱਥੇ ਬਹੁਤ ਸਾਰੇ ਸਟੂਡੈਂਟਸ ਕਈ ਵਾਰੀ ਸਾਨੂੰ ਵੀ ਜਦੋਂ ਅਪਰੋਚ ਕਰਦੇ ਨੇ they have like done entrance exams, ਹੈ ਨਾ? ਕਦੀ ਉਹਨਾਂ ਨੇ
Yes, ma'am.
ਹਸਪੀਟਲ ਦੇ ਵਿੱਚ ਕੋਈ ਜੌਬ ਲੈਣੀ ਹੈ ਤੇ then sometimes they prepare from that perspective. But actual NCLEX is
Yes, ma'am.
a different standard because they're kind of more
Yes,
based
ma'am.
on what the westernized nursing would expect from you guys, right? So
Yes, ma'am.
thanks for bringing that important point ਕਿ ਹਾਂ
Yes, ma'am.
ਇੰਡੀਆ ਦੇ ਜਿਹੜੇ ਐਂਟਰੈਂਸ ਐਗਜ਼ਾਮਸ ਹੈ ਉਹਨਾਂ ਨਾਲੋਂ ਬਹੁਤ ਵੱਖਰਾ ਹੈ NCLEX. This
Yes,
is for
ma'am.
sure. Concepts are of course the same, I agree with you,
Yes,
but it's just like how the things are done here versus in
yes, ma'am.
India is totally different, right? Like this is what
Yes, ma'am.
people they see that. So Raman, ਹੁਣ
Yeah.
ਤੁਹਾਡੇ ਸਟੂਡੈਂਟਸ ਤੁਹਾਨੂੰ ਮਿਸ ਕਰਨਗੇ ਫਿਰ ਜੇ ਤੁਸੀਂ ਹੁਣ ਕੈਨੇਡਾ ਵਾਲੇ ਪਾਸੇ ਆ ਜਾਓਗੇ so ਹੁਣ ਤੁਸੀਂ ਆਪਣੇ ਸਟੂਡੈਂਟਸ ਨੂੰ ਕੀ ਕਹਿਣਾ ਚਾਹੋਗੇ because I'm pretty sure they'll listen to your podcast and they'll get inspiration ਕਿ if their teacher can do it, ਹੈ ਨਾ? ਕਿਉਂਕਿ ਉਹ ਸਾਰਿਆਂ ਦੇ ਵਿੱਚ I think ਇੱਕ ਜਜ਼ਬਾ ਹੈਗਾ ਕਿ ਆਪਾਂ ਬਾਹਰ ਜਾਣਾ ਹੈ so
Yes,
westernized
ma'am.
nursing because nursing is very beautiful here, right? In every way, shape or form. So ਆਪਣੇ ਸਟੂਡੈਂਟਸ ਲਈ ਕੋਈ ਮੈਸੇਜ ਦੇਣਾ ਚਾਹੋਗੇ ਤੁਸੀਂ?
I just want to say that during my clinical, posting with the students, I always try to complete these priority conceptual procedures with
Oh,
them.
that's nice.
And when obviously the procedures are same for nursing in whatever procedures, for example, chemotherapy, radiation therapy, or soma care, the concept and the principles and the steps of care is same. So I always try to teach them according to the priority, so that they can follow in the future if someone is preparing for foreign studies. I just only want to say them that just whatever they are studying, they should just study in a very cleared and focused manner so that they can clear their concepts. It is very easy. Nothing is too much big or something more deep that they cannot do it. It is
That's true.
very yeah
And Raman,
easy.
you have
Not
yourself become a
easy.
role, yeah,
Yes,
you have yourself become a role model, okay, if when they will see their own teacher going through this journey and accomplishing success, and then you can see ਉਹ ਤੁਹਾਡੇ ਤੋਂ ਇਹ ਵੀ ਦੇਖਣਗੇ ਕਿ ਤੁਸੀਂ ਕਿੰਨਾ time ਬਚਾਇਆ ਆਪਣਾ, right? Like when you're
yes,
sitting in
ma'am.
India, like this is another message which we want to give through this video is like you can save lots of your time, like you can do your NNAS processing, you can even do your preparation just like Raman did it from India, right? And you can even
Yes,
write your
ma'am.
exam in India. We have Pearson centers everywhere, right? Which was your
Yes,
center? You
ma'am.
wrote it in Chandigarh, right? Did you say that?
Yes, ma'am. Yes, ma'am. I wrote in Chandigarh and it was also in Gurgaon, Delhi, and there are many other.
Punjab, right? Punjab has like
Yes,
lots
ma'am.
of
Yes,
Pearson
yes.
centers as
Yeah,
well.
yeah. Punjab also has many.
That's
Yes,
amazing.
ma'am.
How?
I also think that.
Yes,
I also think that during one benefit that I think that I got is I cleared NCLEX exam during my job. I didn't take any took any gap during the for preparation.
preparation. Yeah.
I need not to take any vacations from the college. So these are the things
So you
that
were able to
I
simultaneously
got
do that,
benefit.
because I'm glad you said that, because ਮੇਰਾ ਅਗਲਾ ਕੁਐਸਚਨ ਤੁਹਾਡੇ ਲਈ ਇਹੀ ਸੀਗਾ ਕਿ ਜਿਹੜੇ ਤੁਹਾਨੂੰ ਸੁਣ ਰਹੇ ਆ ਹੁਣ ਕਿ ਇੰਡੀਆ ਤੋਂ ਕਿੰਨਾ ਕੁ ਔਖਾ ਸੀਗਾ ਕੋਚਿੰਗ ਲੈਣਾ, was it hard?
Yeah, it was not hard, but you have to set the schedule because when the classes were I guess the timing of our classes was about at 4:30 p.m. of Canada, and during that time in India it is 3 a.m.
Wow.
It is 3 a.m. of morning. So that was a bit difficult. I had to woke up early in the morning to catch up. Sometimes I was not able to woke up and I had to watch the recordings. So these were the things. But yeah, once you just, disciplined yourself and you
That's
just
true.
scheduled, and discipline is the key to get anything you want to have in the life. So I just make a schedule that during that period of time I had to work up, even if you have to watch the recordings, you only have that time, nothing
That
else,
is so
because
true.
at around 6 p.m. I used to reach at my home. So this was very something a bit hectic schedule, but yeah, I try to
And
manage.
that's amazing. I think there is a saying in Hindi as well, है ना? ਹੁਣ ਤੇ ਮੇਰੀ ਥੋੜੀ ਥੋੜੀ ਹਿੰਦੀ ਭੁੱਲ ਗਈ ਹੋਈ ਹੈ, ਨਹੀਂ ਪਰ ਭੁੱਲੀ ਨਹੀਂ ਹੈ ਕਿ ਮੈਨੂੰ ਯਾਦ ਹੈ. ਸੋ ਕੋਈ ਕਹਿੰਦਾ ਨਾ ਕਿ ਜੋ ਜਾਗਤਾ ਹੈ वो पाता है, जो सोता है वो खोता है, right? So this means,
Yes,
no, not khota, gade wala khota, but khota means
yes.
like they would lose something in their
lose
life, right?
lose
So
something.
I think you have already proved it ke, ke swere ut ke, of course, class lagana is a discipline, just like when you go to military training, so you have to stand up, you have to do exercise, you have to follow a schedule. But again, if following a schedule in 3 months can give you something which you always dreamed about, why not, right? क्यों नहीं करांगे आपा? Like, this is the question which you have to ask yourself when those 3 months can change your life. Perfect.
Yes, ma'am.
So, Raman,
Yeah,
have you thought where do you want to work after coming to Canada? कुछ सोचा है, like any dream area where you want to work?
ma'am. I think my in-laws are settled in Toronto area only. That's what I know for now. So I think that will be the area around that. I'll try to find the job place.
That's nice. Yeah, we would love to welcome you to Canada, right? It's gonna be amazing. It's gonna be fun journey, right? Anything else you want to
Yes,
share with
ma'am.
the students? Any tips, any strategies about NCLEX, or anything you want to tell them? Okay, अपना process कितनी छेती हो शुरू करन, या let's just say your students, those who are listening to you, or other students as well. And when do you think is the best time for them to start NNAS? मतलब ਤੁਹਾਨੂੰ ਲੱਗਦਾ ਕਿ ਉਹਨਾਂ ਨੂੰ ਕੀ ਦੱਸਣਾ ਚਾਹੋਗੇ ਤੁਸੀਂ ਉਹਨਾਂ ਨੂੰ?
Ma'am, actually, I started from New York board NCLEX. I am not sure about NNAS whether they directly give eligibility for RN. Some students were saying that NNAS is giving eligibility for RPN only. Only after going there and getting 2 years of study, completing 2 years of study, you can get RN eligibility. So I have New York eligibility. So for that, I can say that the students who have completed their graduation, they can start it immediately after getting degrees and getting their,
Yes, and we
official
also have free
certificates.
video. I just want to say that in the YouTube, we have a free video how to apply to New York. So you don't have to even ask anybody's help, to be honest. You can just directly go watch that video and apply to New York. Absolutely.
If somebody is in India, they should go for NCLEX, New York board, or AFRA. They are also giving eligibility.
Yes, yes. BSc
Yes,
nursing,
ma'am. Because
AFRA gives you eligibility within like, 3 to 4 weeks. Like they are like really quick.
so by the end of the 3 months of coaching, at least 15 to 20 एग्जाम्स तो सबने दे ही दिए होते हैं. तो उस समय तक अपने आप ही कॉन्फिडेंस आ जाता है कि उसमें से अगर 4 5 6 7 एग्जाम्स भी किसी ने क्लियर कर दिए हैं, पास हो गया है, तो चलो 5 6 और करके फिर हम एग्जाम दे देना चाहिए. So that is very great tip that you gave us, that just start doing comprehensive tests and assignments side by side so that you can get some good experience
Absolutely.
about questions.
This, I think, online revolution has changed life of so many people, है ना? मतलब इंडिया तो
Yes,
लोग ही
ma'am.
बैठ के और दूर, like we have people from, as I said, 10 12 different countries. So मतलब ਉੱਥੇ ਬੈਠ ਕੇ ਤੁਸੀਂ ਕਨੈਕਟ ਕਰ ਸਕਦੇ ਹੋ। ਹੁਣ ਮਤਲਬ ਪਹਿਲੇ ਜ਼ਮਾਨੇ ਵਾਂਗੂ ਨਹੀਂ ਰਹਿ ਗਿਆ ਕਿ ਤੁਹਾਨੂੰ ਆਪਣੇ ਸੁਪਨੇ ਕੰਪਲੀਟ ਕਰਨ ਲਈ ਤੁਹਾਨੂੰ ਇਸੇ ਕੰਟਰੀ ਦੇ ਵਿੱਚ ਪਹਿਲਾਂ ਆਣਾ ਪਏਗਾ। You can actually
ਹਾਂਜੀ, yes, ma'am.
fulfill 80% of dream over there itself. ਫਿਰ ਉਸ ਤੋਂ ਬਾਅਦ ਤੇ
Yes,
ਆ
ma'am.
ਕੇ ਸਿਰਫ ਕੰਮ ਹੀ ਕਰਨਾ ਰਹਿ ਗਿਆ, right?
Right.
And then that's
Yes, ma'am.
beautiful. ਮਤਲਬ why do you have to go work odd jobs ਜਦ ਤੁਸੀਂ ਆਂਦੇ ਸਾਰ you can work as a nurse, right? So this is
Yes,
a
ma'am.
this is a question which we want people to think about. So ਰਮਨ, ਜਾਂਦੇ ਵਾਰੀ ਨਾ ਮੈਨੂੰ ਐਗਜ਼ਾਮ ਡੇ ਬਾਰੇ ਦੱਸ ਕੇ ਜਾਓ, ਕਿਉਂਕਿ ਸਟੂਡੈਂਟਸ ਨੂੰ ਬੜੀ ਐਕਸਾਈਟਮੈਂਟ ਹੁੰਦੀ ਹੈ, ਸਾਨੂੰ ਪੋਡਕਾਸਟ ਦੇ ਥੱਲੇ ਉਹ ਕਮੈਂਟਸ ਵੀ ਲਿਖਦੇ ਆ। ਕਿਸੇ ਨੂੰ ਕੋਈ ਸਟ੍ਰੈਟਜੀਜ਼ ਦੱਸੋ ਕਿ ਮਤਲਬ ਤੁਸੀਂ ਐਗਜ਼ਾਮ ਵਾਲੇ ਦਿਨ ਘਬਰਾਏ ਸੀਗੇ, ਜਾਂ ਹਾਊ ਵਾਸ ਯੋਰ ਐਕਸਪੀਰੀਅੰਸ, ਜਾਂ ਤੁਸੀਂ ਆਪਣੇ ਆਪ ਨੂੰ ਕਿੱਦਾਂ ਕਾਮ ਡਾਊਨ ਰੱਖਿਆ?
Ma'am, yeah, I was very anxious and very nervous at during exam day, but it just happened. I was always about 1 week before giving exam. I was very nervous. I was thinking that I should postpone my exam, but somehow my heart was saying that no, no, don't do this, don't do this. You just give exam. It's okay if you will not clear. You will get some experience. You just do it, you know, otherwise it will be too late. Like I was thinking about 15th of Feb, but then I didn't got the date of 15th or 13th of Feb. So 31st of January was, empty. So I booked exam on that date. So during the day of the exam, when I reached there, I was deep breathing. I was deep breathing before entering the that Pearson view. And when I just sat on the chair, also, before starting the exam, I deep breath and I said to myself that Raman, you have 5 hours. It's not like IELTS exam that you only have 40 minutes for writing,
Yes.
30 minutes for listening. You have 5 hours. You can give, you can spend 15 minutes for one question or you can spend 20 minutes for two questions. It's okay. Ma'am has said that you can clear exam even if you are short of time. So I was thinking those things in mind, and I was not
Staying
I was
positive.
just, yeah, I was thinking positively, and I was just doing the exams. Then after 75, when it didn't shut down, I was little bit uh, uh, nervous, and then I also thought that ma'am said it's okay if after 75 the exam didn't shut, that means you still have the chance to pass the exam. Then I
How many
after
questions you got?
75, I'm 113.
113. So basically run out of time rule.
Yes, ma'am. Yes, ma'am.
Or it shut
So,
down, or the computer shut down at 113, or it was like a run out of time.
no run out of time. It was 113.
Computer
The
shut down.
computer shut down at 113. I had 1.5 hour left during that
Wow.
time. Yes, ma'am.
That's amazing. That's brilliant.
So,
So Raman,
yeah.
that's like really, really, and I want to say it's a big thing. Reason being is कि you're sitting over there, you have never practiced westernized nursing. It was all
Yes,
you had
ma'am.
to imagine, right?
Yes,
How we
ma'am.
do it, right? And more of an imagination how to implement those strategies, right? So I would just say you have done a commendable job. We are really, really
Yeah.
proud of you. And then, the people who are listening to you, whether they are your students, their colleagues, and they will get like lots of inspiration for you. So any last message, Raman, you want to give to the students in India, Canada, everywhere, those who are listening to you?
I just want to say those who are taking coaching from you, just listen to Taran ma'am. She whatever she is saying right. I didn't do any other books, although I had many other books for questions, extra questions I had in my phone. I deleted all these questions. I just did the software
You follow the
and the
recipe.
questions of the module. Yeah, follow the recipe. That is very true. Follow the recipe.
Follow the recipe. Okay,
Yes, ma'am.
perfect.
And to students who are in India, I think if they want to go foreign or in any country, so they should start their process as soon as
As
possible.
soon as possible. Perfect. So how was your family's reaction when you passed? Yeah. What does your
Ma'am,
family?
after giving the exam, my papa was very bad. You know, you said that
The
when
Pearson one.
you yeah, the Pearson one, when you go for the registration, they will say that you can't make any registration further. So it wasn't the same in my case. So I was crying after giving the
So
exam,
you are
after
out of
coming
those
back.
1% students where trick doesn't work.
Yes, ma'am. So
Wow.
again, I opened the laptop after coming, after coming from that center. So again, that trick doesn't work. So I was trying. I thought I just failed. Then my friends suggest me that you should wait for 48 hours and then we'll see what happens. Then after 48 hours, I checked the exam
Check the
and I
quick
was
result.
sure that when the trick is not working, also might be I failed the exam, but and then the status was yes, you passed.
Wow,
Status
that's
was
amazing.
passed.
Yeah, because this is also true. I'm glad we are discussing this in the podcast. That trick works for, I would just say, 90 to 95% student, but sometimes, there are few, I'm not gonna say like all, but still there are 3 to 4% or sometimes, 1 to 2% chances that the trick doesn't work, right? So, wow, that's good.
Yeah,
It's very reassuring for the people, those who are listening to you, that, that sometimes,
because
okay, don't lose hope because you never know,
and ma'am, because whenever I used to practice the CAT exams, my most of the times, I would say 80 to 90% of the cases, my exam shut down between 75 to 145. So I passed those exams, almost all exams during when my exam shut off between 75 to 145. Rarely one or two times I passed at
Mhm.
75 questions. So I was pretty sure that Raman, अगर तेरा पेपर 75 to 145 ਦੇ ਵਿੱਚ ਤੇਰਾ ਜੇ ਰੁਕ ਗਿਆ ਦਾ ਮਤਲਬ ਤੂੰ ਪਾਸ ਆ. And it stopped at 113. So I was very happy only that point of time. And
Okay, you
case
pass.
studies ਤਾਂ ਮੈਂ ਧਿਆਨ ਨਾਲ ਦੇਖਿਆ ਹੀ ਨਹੀਂ, ਮੈਂ ਕਿਹਾ ਬਸ ਇਹਦੇ ਤੇ ਬਸ ਕਰਦੇ ਜਾਓ
Case studies are
ਮੈਂ
going to
ਬਸ.
start from 1st April, right?
Yes ma'am,
ਅੱਛਾ,
okay, okay.
ਸੋ ਫਿਰ ਘਰ ਦੇ ਖੁਸ਼ ਹੋਏ ਕਿ ਨਹੀਂ ਪੇਪਰ ਤੁਹਾਡਾ ਕਲੀਅਰ ਹੋਇਆ ਤੇ?
Yes, ma'am. All are happy. I'm just thinking that I'm in Canada. पेपर मेरा clear हो गया. मैं तो ਹੁਣ RN ਦੀ job ਕਰਨੀ ਜਾਣੀ ਹੈ.
There you go, that's amazing. ਤੇ ਹੁਣ ਤੁਸੀਂ ਇਹ ਦੱਸੋ ਕਿ FBNPC ਟੀਮ ਨੂੰ ਤੁਸੀਂ ਲੱਡੂ ਕਦੋਂ ਖਵਾ ਰਹੇ ਹੋ?
Ma'am, once
ਹੁਣ
I
ਤਾਂ ਤੁਹਾਡੇ ਵੱਲ ਦੋ ਦੋ
reach
ਲੱਡੂ ਹੋ
and
ਗਏ, ਹੁਣ ਤਾਂ ਵਿਆਹ ਦਾ ਲੱਡੂ ਤੇ ਤੁਸੀਂ ਹੁਣ ਪੇਪਰ ਕਲੀਅਰ ਦੇ ਲੱਡੂ.
yes, ma'am. Once I reach Canada, I'll surely meet you. Yes, ma'am.
Oh, thank you so much. No, it was pleasure. Thanks, Raman, for taking the time out of your schedule. And day and night, the difference when we are doing this podcast. So we really, really appreciate that you took the time out of your schedule. And all the podcasts are, I think, very inspirational. So people sometimes, podcast का मतलब यही है कि we want to inspire each one of you who's sitting behind that camera, ਜਿਹੜੇ ਹਲੇ ਵੀ ਸੋਚ ਰਹੇ ਆ ਕਿ ਯਾਰ ਕਰੀਏ ਨਾ ਕਰੀਏ ਕਰੀਏ ਨਾ ਕਰੀਏ, ਰਾਈਟ? ਸੋ ਤਾਂ ਹੀ ਅਸੀਂ ਇੰਨੀਆਂ ਸਾਰੀਆਂ ਜਰਨੀਜ਼ ਤੁਹਾਡੇ ਲਈ ਲੈ ਕੇ ਆਉਂਦੇ ਹਾਂ, ਡਿਫਰੈਂਟ ਡਿਫਰੈਂਟ ਸਟੂਡੈਂਟਸ ਦੀਆਂ, ਕਿ ਹਾਊ ਦੇ ਨੈਵੀਗੇਟ ਥਰੂ। ਕੰਮ ਕੋਈ ਵੀ ਆਸਾਨ ਨਹੀਂ ਹੁੰਦਾ, ਸੌਖਾ ਕਿਸੇ ਲਈ ਵੀ ਨਹੀਂ ਹੁੰਦਾ, ਐਵਰੀਬਡੀ ਹੈਜ਼ ਟੂ ਵਰਕ ਹਾਰਡ ਫॉर ਇਟ, ਐਂਡ ਬਟ ਐਟ ਦ
Yes, ma'am.
ਐਂਡ ਜਿਹੜਾ ਰਿਜ਼ਲਟ ਹੈ ਨਾ ਉਹ ਬਿਊਟੀਫੁਲ ਆਉਂਦਾ। ਸੋ ਰਮਨ, ਤੁਹਾਨੂੰ ਬਹੁਤ ਬਹੁਤ ਵਧਾਈ, and for your NCLEX and for your future journey in Canada and for your marriage. So we are looking forward to welcome you here in Canada. Congratulations.
Thank you. Thank you, ma'am. Thank you very much.